With an assortment of new drugs, some new trials, a lot of controversy and debate, it's really about time to take a practical management look of anticoagulation in patients with atrial fibrillation. That is the state-of-the-art review coming in the April 7th issue of JACC. And I'm with Dr. Richard Kovacs, MD, Professor of Cardiology and Clinical Director of the Krannert INstitute of Cardiology, Indiana University School of Medicine. Now, this is part of the ACC Anticoagulation Consortium Roundtable, which is where this comes from. Tell me about the roundtable first. Why did that get put together?
Well, the roundtable got put together because anticoagulation in the United States and worldwide is a team sport, and it's not just governed by cardiologists, but it's governed. It's managed by internists, anticoagulation clinics. People get put in the hospital and are cared for by hospitalists, and they have procedures done by other specialties. And then, if they have a complication, they may even have to visit a surgeon, or, heaven forbid, a neurosurgeon.
Right. So in this particular paper, this review, what are you looking at? What are you trying to address?
Well, there are huge gaps in our information with all of the new drugs that have come out and warfarin still being used in a large percentage of people, plus a large gap in appropriate anticoagulation for people that are eligible for anticoagulation. So we decided to bring everybody to Hard House and ask specific questions, and we did it in a roundtable format, teed up a few specific topics, and then asked the assembled folks to give us their opinions.
What were some of the topics?
We talked about initiation of anticoagulation. We talked about interruption of anticoagulation. We talked about what do you do if there's bleeding. We talked about special populations. And we talked about a lot of things.
Was this a lively conversation?
Oh, very much so. Very much so. There was not a lot of lecturing in this. We simply teed up the question, put it out for roundtable discussion in small groups, and then asked each group to report back. And that was the fodder for the paper.
So for people who are going to this review, what are they going to find?
They're going to find up-to-date, practical, consensus answers to their questions.
I mean, there are guidelines, clearly, but what you're trying to do is answer some of the areas that are in between the questions and the guidelines that are proposed or at least brought up to discuss?
Absolutely. How do you select between agents when the agents haven't been compared head-to-head?
Right.
How do you manage a patient who has atrial fibrillation and an acute coronary syndrome, or a patient who has an acute coronary syndrome and atrial fibrillation? There are trials going on now to inform us on those, but there's no information to handle the patient in 2015.
So is this a group that's going to get back together again, and are they going to deal with atrial fibrillation or some other topic?
They'll be back together this year under new leadership. The co-chairs will be Judd Doherty and Greg Flaker. Oh, yeah. And they will lead a new discussion on new topics, and I know they're very, very interested in bridging.
Well, this is a wonderful state-of-the-art review, and it is in the April 7th issue of JACC, so please take a look at it, and the practical management of anticoagulation in patients with AF. For CardioSource World News, I'm Executive Editor Rick McGuire.